This is Dr. Havens. This is our week 2 presentation in the leadership course, the third of 3 chapters for this week. This week our assignment is chapter 4, chapter 5, chapter 6. This is our recorded lecture for chapter 6, focusing on delegation and prioritization of client care staff. In this chapter, we'll be discussing the legal implications of making assignments to other healthcare personnel. We'll discuss the term delegation, talk about priority setting in patient care, and making the most appropriate assignments to various members of the healthcare team. Registered nurses must understand the responsibilities, accountabilities, and authority that's related to delegation. That's what we're going to be talking about in this chapter. Decisions are made on the basis of public safety. Their responsibility is to provide safe, effective, quality care. And this can cause challenges and concerns when RNs delegate duties to nursing assisted personnel such as CNAs. So delegation is a fairly significant issue in nursing. The reason being is there are so many nurses, only so many nurses to go around. There are more and more patients, increased life expectancy, and more care needed and available. What this means is that people are living longer because of new technologies in healthcare, new medications. So there are more people to take care of longer, and the therapies tend to be complex. Florida is the third most populous state in the U.S. We have currently 20 million people living down here. 20% of them, are about 4 million people, are age 65 or older. The average 65-year-old in the United States has 11 prescription medications and 3 chronic illnesses. It could be that they have hypertension, glaucoma, and arthritis. Maybe they have diabetes, they've had a stroke, and they have some other condition. But people are living longer because we can take better care of them, but this requires more nursing and thus the need for delegation. So the NCSBN, or the National Council of State Boards of Nursing, describes delegation as transferring authority. The RN has the ability to request that another person do a task, even though that individual may not be permitted or regularly licensed to do so. However, it's the RN that maintains the accountability for supervising those personnel or employees to whom the tasks are delegated. It's important to understand the difference between making an assignment and delegating to a CNA or an NAP. For instance, it's making an assignment if you direct that person to take a set of vital signs because they are already authorized and qualified to take vital signs on their own. However, if you ask them to do a task such as measuring the amount of drainage on a post-operative dressing, this is considered delegating because normally this is something that the RN would do, and the RN would therefore maintain the responsibility for this action even though they're directing another employee to do it. So it's important to match the skill set of the healthcare personnel with the needs of the client. And this is what actually defines the difference between delegation and assignment. So a CNA can be assigned to take vital signs, but they would be delegated to check the bandage of a fresh post-operative patient if the RN delegates them to do so. So the individual state nurse practice acts define the legal boundaries for nursing practice in each of the 50 states. The Nurse Practice Act determines what the RN can do, what the LPN can do, and what the CNA can do. All nurses need to understand the guidelines that are set forth in their state's Nurse Practice Act. In Florida, this can be found in Chapter 464 of the Florida statutes. However, according to the ANA, our professional association, the American Nurses Association, there are some principles that remain firm throughout all 50 states regarding delegation, and these include the following principles. The nursing profession delineates the scope of nursing practice. This means that the doctor doesn't determine what we do, or some other group of people. Nursing delineates our own scope of practice. The nursing profession identifies and supervises the necessary level of education and training, and also the use of ancillary roles that go along with the delivery of patient care at the bedside. According to the ANA, the registered nurse assumes responsibility and accountability for providing the nursing care and expertise of patients, and the registered nurse directs and determines the appropriate utilization of any ancillary personnel, such as the CNA or NAP, involved in helping with the direct patient care. The registered nurse also accepts assistance from the CNAs and NAPs in delivering nursing care for the client. The principles that we need to use when we consider what tasks can be delegated and to whom are as follows. The registered nurse has a duty to be accountable for personal actions related to the nursing process. The registered nurse considers the knowledge and skills of any NAP or CNA to whom they're delegating certain acts of care. The decision to delegate or assign is based on the registered nurse's judgment about the following. Number one, the condition of the patient. Number two, the competence of the members of the nursing team. And number three, the amount of supervision that will be required of the registered nurse if a task is delegated. The registered nurse should use critical thinking skills and professional judgment when following the 5 rights of delegation that we will cover here in a moment. The registered nurse recognizes that a relational aspect exists between delegation and communication. Communication needs to be culturally appropriate. This applies to whether or not an interpreter is needed. And the individual receiving the communication should be treated with dignity and respect. Chief nursing officers are responsible for creating systems within their facility to assess, monitor, verify, and communicate continuous competence requirements in areas related to delegation. And registered nurses monitor organizational policies, procedures, and job descriptions to ensure that they are in compliance with the Nurse Practice Act, and they should consult with the State Board of Nursing as needed. The 5 rights of delegation include the right task, the right circumstance, the right person, the right communication or direction, and the right supervision or evaluation. It's important to know that delegation can be indirect or direct. Direct delegation is defined as verbal direction by the registered nurse regarding an activity or task in a specific nursing care situation. In this case, the registered nurse decides which staff member is capable of performing the specific task or activity. Let's look at an example of delegation. This is a case study from page 84 of the textbook. Mrs. Ross was admitted to the neuro unit from the NICU. She suffered a right hemisphere intracranial bleed a couple of weeks ago and has some left hemiplegia. She has difficulty swallowing and she receives tube feeding through a percutaneous endoscopic transgastric jejunoscomy tube. However, she's being advanced to a pureed diet. She needs assistance with her personal care, toileting, and feeding. The physical therapist comes twice a day to get her up for gait training. Otherwise, the primary care provider wants Mrs. Ross up in a chair as much as possible. So after performing the nursing assessment, the registered nurse might consider assigning a licensed practical nurse to this client. The swallowing problem places the client at risk for aspiration, which means that feeding may be a problem. Based on the skill level and education of an LPN, the LPN is capable of managing the tube feeding. However, it may be questionable as to whether the LPN could begin the oral feedings. In this case, interprofessional care assistance from the speech therapist is in order and an evaluation. It's the speech therapist that evaluates swallowing. So the LPN can help with bathing, range of motion, skin care, and all the other tasks, but we're going to do an interprofessional consultation before beginning the tube feedings. Let's talk for just a minute about the concept of supervision. The term supervisor implies that the individual has authority over others. However, they may not necessarily have authority over the CNA or NAP in terms of hiring and firing decisions or doing their evaluation. What this means is supervision is more direct and requires direct oversight of the work or performance of others to whom the tasks are being delegated. So the supervision would include checking on the workers throughout the day to see what activities they've completed and what assistance they may need in finishing their tasks. When one registered nurse works with another, even though one is the charge nurse and the other is a staff nurse, supervision is not needed. This is a collaborative relationship. Individuals who supervise others delegate tasks and activities. The CNO or the chief nursing officer can delegate tasks to an associate director. These are administrative tasks such as unit reports, record reviews, or reports of client acuities, and so on and so forth. Supervision sometimes entails more direct evaluation of performance, such as annual performance evaluations, or discussions regarding individual interactions with clients and other staff members and activities of that nature. It's important to understand that it's not just the people in upper management or higher leadership that can delegate work to other people in the organization. Registered nurses will be responsible at times for delegating some of your work to other nurses, to technical personnel, and to other members of the interprofessional team, such as the speech therapist that we just referred to. So before deciding who should care for a particular client, the registered nurse should assess each client's care requirements, what their needs are, and set client-specific goals, and then match the skills of the person assigned with the tasks that need to be accomplished. Thinking this through before delegating helps prevent problems later. And then next, the RN will make the assignment of the task to the appropriate person. This is using the nursing procedure. It's assessment, planning, and implementation. Then the registered nurse must oversee that care and determine whether the client care needs have been met. This is the fourth part of the nursing process, which is evaluation. It's also important for the registered nurse to allow time during the day for feedback. This enables all personnel to see what's been accomplished and what still needs to be done before the end of the shift. So because of the nursing assistant, there's an increasing need for healthcare organizations to employ NAPs. More than 90% of hospitals currently employ some type of nursing assistant. However, it's important to realize that many registered nurses believe that they know how to safely delegate tasks to the NAPs, but this is not necessarily the case. The American Nurses Association defines an NAP as an unlicensed assistive personnel or nursing assistive personnel. They're individuals who are trained to function in an assistive role to the registered nurse in the provision of patient care activities as delegated by and under the supervision of the registered professional nurse. Although some of these people may be certified, such as a CNA, it is important to remember that certification differs from licensure. When a task is delegated to an unlicensed person, the professional nurse remains personally responsible for the outcome of these activities. The use of an RN staff to provide all of the care that a client needs is not considered by most hospitals to be the most efficient or cost-effective use of professional time. More hospitals are moving away from using LPNs and hiring RN staff with assistive UAPs or NAPs. So in these facilities, the nursing care focus is directed at diagnosing client care needs and carrying out complex interventions by the RN. The ANA cautions against delegating nursing activities that include the foundation of the nursing process and that require specialized knowledge, skill, or judgment. This slide has some other position statements and definitions of delegation. This is just a summary of what we've discussed in previous slides. Delegation is transferring to a competent individual the authority to perform a selected nursing task in a selected situation. To delegate tasks safely, nurses must delegate appropriately and supervise adequately. On page 86, you'll see the delegation decision-making grid that was developed by the National Council of State Boards of Nursing. This is a tool to help registered nurses delegate appropriately. It provides a scoring instrument for several categories that you should use when making delegation decisions. A low score on the grid indicates that the activity may be safely delegated to UAPs or personnel other than the registered nurse, but a higher score indicates that delegation may not be advisable. Our next slide discusses briefly what should never be delegated to an NAP or UAP. Registered nurses cannot delegate what they can eat, EAT. This has to do with evaluation, assessment, and planning, because a CNA is just not qualified to do the nursing process of this nature. Page 86 delineates the 5 factors that RNs should use for determining if client care activity should be delegated. Number 1, potential harm for the patient. Number 2, complexity of the nursing activity. Number 3, the extent of problem solving or innovation that would be required in the care. Number 4, the predictability of the outcome. And number 5, the extent of the interaction. The purpose of delegation is not to assign tasks to other workers that you don't want to do yourself. When you delegate to others effectively, the result you have is more time to perform the tasks that only a professional registered nurse is permitted to do. In delegating, the RN must consider both the ability of the person to whom the task is going to be delegated and the fairness of the task. In other words, can this person do it safely? Is this a complex task? Is it a professional responsibility? Does the person have time to do it? And is the workload evenly distributed among the team? All of this must be considered. The ANA has specified tasks that registered nurses may not delegate, including decisions and judgments about patient outcomes, determination and approval of the client care plan, interventions that require professional nursing knowledge, decisions, or skills, and decisions and judgments necessary for the evaluation of client care. The primary concern in delegating is whether the person assigned the task has the ability to successfully complete it. To make appropriate assignments, the registered nurse needs to take into account the knowledge and skill level, the legal definitions, role expectations, and job description for each member of the team. It's also important to consider that each individual within each skill level possesses their own strengths and weaknesses that have to be considered. People should not be assigned a particular task that they don't have the skills or knowledge to perform, regardless of their professional level. People are often reluctant to admit that they lack the ability to do something. Instead of seeking help or saying they're not comfortable with the task, they may avoid doing it, delay starting it, do only part of it, or even try to bluff their way through it, which is a very risky choice in healthcare. Regardless of the length of time that an employee has been in a position, they will need orientation when assigned a new task. Those who seek assistance and advice are showing concern for the team and the welfare of their clients. Requests for assistance or additional explanations should not be ignored, and that person should be praised rather than criticized for seeking. So as we know, the work of a busy nursing unit rarely ends up going as expected when you're dealing with sick people as well as their families, team members, physicians all at the same time. It's a difficult task. Setting priorities for the day should be based on client needs, team needs, and organizational needs. This should be discussed with your team members so that decisions can be made based on team priorities. One way to determine priorities for patients is based on Maslow's hierarchy of need that you may remember from psychology class. This is frequently used in nursing to provide a framework for prioritizing care. Basic physiological needs come first because they're necessary for survival. For example, oxygen and medication administration, IV fluids, and tube feedings are included in this group. Identifying the priorities and deciding which needs need to be met first can help in organizing care and deciding what team members can meet the client needs. For instance, nursing assistants can meet many hygiene needs, allowing licensed personnel to give meds and enteral feedings in a timely manner. Our current healthcare delivery environment calls for cost-effective and efficient care, and delegating appropriately can increase efficiency and save money for the organization. Similarly, incorrect delegation can decrease efficiency and can cost money. When delegating tasks to individuals who can't perform the particular task, RNs often have to go back and perform the task. Special problems occur when nurses are floated to other units where they don't normally work and are not familiar with the tasks that need to be done. It can be counterproductive, for instance, when a coronary care nurse is floated to labor and delivery. There will be time needed to teach him or her the necessary skills for safe and effective mother-baby care. So what are some barriers to effective delegation? Many registered nurses, especially when they're newly licensed, have difficulty delegating for a variety of reasons, including inexperience, quality of care issues, and just not being familiar with the delegation process. What are some licensure issues that are related to delegation? So courts have ruled that nurses are not liable for the negligence of other individuals, provided that the nurse delegated appropriately. If you delegate to an NAP or an LPN and they commit an act that is later deemed to be negligent, then the RN is not responsible for the negligent. They're only responsible for having made the assignment and delegating. So the art and skill of delegation are acquired with practice over time. You get better at it and you develop expertise. Next, we're going to look at the criteria for delegation based on the patient care needs. This lists the RN skills. Basically, the nursing assessment falls to the RN as well as most IVs, hanging blood, the care plans, physician orders, and patient education. The LPN does vital sign. In some states, LPNs are licensed or certified to give some IV meds. And then the physical care, most of the hands-on bedside direct care. The interprofessional care, even though the nurse is the care manager, like the evaluation for swallowing to advance the diet from tube feeding to pureed, would fall to the speech therapist, and then ambulation would fall to the physical therapist, and so on and so forth. And then the CNA or the NAP can be responsible in some cases for the feeding, most hygiene, and most hands-on physical care of the patient. This slide talks again about the legal boundaries for nursing practice as identified in the State Nurse Practice Act. One thing to know is that delegated tasks should not be sub-delegated. For instance, if you assign a task to an LPN, they should not turn around and then delegate it to the CNA. That's not such a good idea. That can cause legal issues. Registered nurses have expressed concerns about the quality of patient care when tasks are delegated, such as turning patients, ambulation, blood glucose monitoring, and so on and so forth. If these are missed or omitted or delayed, then it adversely affects patient outcomes. So when you delegate, you control the delegation. You decide who is the best person to whom to delegate that task and who is most likely to be able to successfully get it done. Some nurses think that they must do everything themselves, and this can make it difficult for them to assign work to others. Some nurses distrust subordinates to do things correctly. And some nurses are more comfortable with the task-oriented or technical aspects of patient care than with the more complex issues of the nursing assessment, nursing care process, and patient teaching. So these are some problems that arise in terms of delegating tasks to others on the job. Nurses need to know how to effectively prioritize care for all the patients on their unit. Prioritization is defined as deciding which needs or problems require the most immediate action and which could be delayed until a later time because they're not urgent. So this is an important part of making your assignment and delegating care. There are 3 levels of priority setting. Number 1 is, of course, the ABCs: airway, breathing, circulation, plus vital signs. These are the most critical. Number 2, addressing alterations in mental status, untreated pain, other medical issues, and abnormal lab values. And then number 3 is to consider long-term or chronic health problems, client education, and coping strategies. Nurses need to evaluate and assess the situation for each patient in terms of the urgency or the priority of completing each task. One of the more difficult tasks for a new registered nurse is to learn how to coordinate daily activities for each shift. There are clinical pathways, concept maps, and computer information sheets that can identify your patient needs, but they usually don't provide a mechanism for coordinating the actual delivery of care. Here are some tips for organizing the workflow. Number one, plan your time around activities that need to occur at a specific time, like a patient going to surgery or going for a procedure. Next, do your high priority activities first and get them out of the way. Third, determine which activities are best done in a cluster, maybe at one end of the hall or that kind of thing. Next, remember that you are responsible for activities delegated to others, so make sure that you allow time for feedback with those individuals throughout the shift. And then consider your peak energy time when scheduling optimal activities. Last but not least, let's look at different models of nursing care. Functional nursing is what we call task nursing, and this is not holistic client care. The needs of the client are categorized by task and then assigned to the best person for the job. So this method takes into account the skill set and the scope of license of each particular caregiver. So what functional nursing looks like is you might have the CNA running around doing all the personal care, you know, the oral hygiene and the bed baths and going from patient to patient and something along this line. And it's just a little bit disjointed. It gets the job done, but it may not be, it's not the most patient-centered care is the way I would do it. It's focusing on tasks and not on the whole patient. The second model of nursing on this page or method of delivery is team nursing. In this model, the RN is the team leader, and then the team would consist of another RN, an LPN, and a CNA. The team leader directs and supervises the team. The team knows the condition and needs of all the clients on the team, and they work together. So this is pretty good. The third model is primary nursing, and in this, the RN devises and implements and maintains responsibility for care of the whole patient during the whole time that this person is on the nursing unit. So the primary nurse is assigned on admission. So on the days off of the primary nurse, somebody else is assigned to cover for that nurse's patient. This is a fabulous form. However, it pretty much requires an all RN staff, which is not terribly cost effective for hospitals. So in conclusion, delegation is not new. We've been doing this a long time. Use Maslow's hierarchy of needs, use worksheets, use other tools to effectively delegate to other personnel, use the delegation decision-making grid to help with the assignment. It takes time for new registered nurses to learn how to organize and prioritize patient care. Knowing the staff and their capabilities simplifies the delegation process, and utilizing staff members' capabilities can create a pleasant and productive working environment as well as high quality care for the patients for everyone involved. Thank you.